So again, I am just summarizing what Ashok said. There should be a duty between you and the patient. There should be a breach of contract and a resultant harm. Somebody put a dilating drops and I had some redness, and ideally you cannot go for a case unless you can claim that it's mental harassment and all. So it is resulting harm should be there. So as Sir said, it is difficult to put criminal liability because the problem is the police station people only will decide which this thing to charge, 304A or 304. All these things should not be charged. In fact, IPC 304A causing death by negligence is the worst thing that we can have. IPC 304A, and court has clearly said when you can charge IPC 304A. Unfortunately, everywhere now doctors are charging. In Rajasthan, one gynecologist committed suicide because the local police person, with the help of a politician, charged 304A and arrested the doctor. That should not be done. And we have some defenses like section 80. Nothing is an offence which is done by accident or misfortune without causing something intending to cause damage. And this 80 and 88 we can always use at our defence. So this case is the most important thing. Jacob Matthew versus State of Punjab. In that case, one old man died. The son created all cases, and he wanted the doctor to be arrested on criminal liability. And this case was landmark in the sense the Supreme Court said what is criminal liability and when a doctor should be arrested. Negligence is a breach of duty, and they defined what is negligence, and they said that gross negligence only you can arrest a doctor, unless that you cannot charge 304A. So this is the basic, but many policemen don't do this. There was another case called Suresh Gupta versus NCT of Delhi, where it was actually a negligence because that cuffed endotracheal tube was not used, aspirated and died. But there also the Supreme Court said that you cannot charge criminal negligence. It was a negligence, and consumer protection they were punished. But gross negligence or recklessness is not there. So they also defined. So these two cases define what is criminal negligence when they can charge criminal prosecutions of doctors. So every mishap or misfortune in the hospital or clinic is not gross act of negligence. There is a problem. I think there are two problems. One is what is negligence and what is complication. These two are not clearly known to the public. Yesterday I had day before yesterday I had a patient. After cataract surgery, there was a vitreous hemorrhage. First thing there is kai pidavana, that is negligence. I said it is not kai pidava negligence, it is a complication. So there is a big difference that they don't understand. And there was another case, Kusum Sharma versus Batra Hospital. There also the court clearly said professional doctor is clearly not negligent just because his conclusion is little different. You suggest something, some other person suggests something. These are all cases all of us should know. But when you file a reply, you should all quote these things. And so your opinion may be different from another person's opinion. Doesn't mean that you are negligent. And doctor should not be unnecessarily harassed, and they are entitled to get protection. See, few things are there in this verdict. So medical negligence became part of CPA after this IMA versus VP Shanta case in 1995. Then we were included, and later in 2019 it was little more elaborated. 2019 CPA modification, and even now we are there, and the amount, the ceiling of the amount Ashok just told. You should know few things. You should respect the autonomy of the patient. Way back in 1914, Justice Cardoso, this is the first, he said, if you do an operation without the patient's consent, you are committing an assault. So the basic thing is consent. And half of the cases are lost because of bad consent. Okay, that is half of the cases are lost because of bad consent. So autonomy of the patient is of utmost importance. Then I should tell what is Bolam's test. This was a case 1957. Basically, patient had ECT, electroconvulsive therapy, for some disease, and then he had a fracture. So he sued the NHS that time, saying that I was not informed. But the court let the doctor loose, let the doctor free. because they said this is a standard procedure and none of the other doctors do this. So whatever has been done is as per the standard guidelines. So at that time doctors were given importance, doctors were given listened by the court. Now it is not like that. So but in India still this ball-arm test is continued, followed, and the court will see whether this is a standard treatment offered by all other doctors. Most of the cases, somebody from the medical college will be called and they will be, okay, this is standard thing, fine, ball-arm test, okay, no negligence. So even in India, this is still ball-arm test. Now later, there are a lot of examples in India. Martin D'Souza versus Mohammad Ishfaq case, where somebody gave amikacin for a severe urinary tract infection and lost a hearing. But court said this is a standard, this is resistant infection, he has given standard treatment. So he was not negligent. Later, this is another case, Lakshman Joshi versus Trayambak Babu Godbole. This case, what they did was reduce the fracture without giving proper anesthesia and had a shock and patient died. Here, the general opinion of the doctors were they should have given anesthesia. So ball-arm test, he failed. So he was made liable. So like this, court will see what is the standard treatment. In India, this is followed, and we have to do what is being written in the books and other ophthalmological group. Now later, Bolitho test came. Bolitho test is little more against doctors. So this was 1957, now it is 97. Bolitho test, basically there was a case with croup, diphtheria, and patient died of respiratory failure, and lot of doctors said I would have intubated. Some other doctors, experts said I would not have intubated. There was an opinion difference between the doctors. Then the court decided that we cannot take the opinion of the experts like that because there is differing opinion. Court will see it is logical, and then doctor was punished actually. So later the court has taken a step to analyze the result of the expert witness, and then they will decide. So a little more things are against the doctor. As he said, it is again for the victim, not for the doctors. Bolitho's application has been made in a lot of cases. This is Malay Ganguly versus Sukumar. Here somebody gave I think toxic epidermal, Stephen Johnson, one variant of Stephen Johnson, and they have given steroid and some complications occurred. Then the doctor said this is standard treatment. But the court analyzed the thing, and Supreme Court found out that the dose and the tapering and everything was wrong, and he was punished actually. So court has started looking into the matter little more in detail. So that is the, so don't just, you have to follow the standard guidelines, but be little more careful. So that is Bolitho's test effect. Now court is deciding what is logical, what is not the standard practice, what is logical also. Now more troubles are there after Bolitho, especially in US and Australia, Canterbury versus Pence. The shift of doctor-centric verdict has become now patient-favored verdict. Now everything has to be informed to the patient, and patient is the king. So even US and all, Canterbury case and all, if there is any change in the informed consent, you have not mentioned a remote possibility, doctor will be sued. So that is a shift of paradigm. Later, even in Australian court is also still very strict about all these things. Somebody did not mention sympathetic ophthalmia, he was sued after cataract surgery. So this is the extreme. We are not in that stage. We are still in Bolam and little Bolitho. So nothing to worry. Now I was talking about some judgments. It is called the judge-made law. There are law is made by legislature, parliament, and it is implemented by executive, and interpretation of the law is done by the court. So Supreme Court say, okay, there is a law, you have to do like this, then somebody will implement. So Supreme Court says in a verdict, this is this. It is a judge-made law, not made by parliament. So it is applicable to everyone. Like for example, this is a standard Vishaka versus state of Rajasthan. This case, Supreme Court made a lot of things, sexual harassment against women in the workplace. So there is no law like that. But after this, every hospital or every workplace has a sexual harassment cell and all. So this is a judge-made law. Like that, there was another Article 21 of the Constitution says your rights, right to life and right to personal liberty. But there is no right to health in Indian Constitution. So after this Paramananda Katara versus Union of India, where an emergency case was not attended by a lot of doctors and patient died, then court said right to health is also part of our constitutional right. So then it became constitutional right, Indian. So these are all judge-made laws. So we can always quote in our cases all these judgments. When we quote the judgment, our case becomes stronger. So everyone should know. Now this, as I have been stressing, consent. Half of the things are due to lack of consent. And Samira Kohli versus Prabha Manchanda was a classic case. This lady, 42-year-old lady, underwent examination under anesthesia for a uterine mass or something, and during this thing, laparoscopy or something, they found that there is ovarian tumor. The doctor just went out and asked the mother, only mother was there, unmarried, and she said, okay, remove. Then he removed, Dr. Prabha Manchanda removed the uterus and the ovary. Later, the lady was going to marry someone, and they found that ovary is not there, they cannot conceive. So they gave a case, and in this case, the court has given specific guidelines regarding consent. We are all following true and legitimate consent that is needed for a surgery. Don't do anything outside your, suppose you do a EUA and find a tumor or something, don't just enucleate. Give one more GA and then do the enucleation. That's fine. Just tell there is a tumor, can I remove? After one day only he will recognize that he removed the eye. So don't do anything outside the consent. This is very important. So unless the patient is a minor or some who cannot give a consent. So medical litigations are due to lack of consent. This study was published. Half of the medical litigations in Korea was due to improper consent. Very clearly mentions. So in UK it is valid and real consent. Valid and real consent given voluntarily by a person who has the capacity to give and competent to give a consent. And you give only minimum adequate information regarding the surgery. Don't tell remote complications. In US, it is informed consent. Everything should be there. Nature, purpose of treatment, outcome, alternatives, risk associated with no treatment, then patient will decide. So you have to mention everything. India has not gone to that extent. So element of consent, I said, if suppose the patient is a 16-year-old boy, it is better that you take the consent from that boy also, because they know something more than, so you take the parents' consent, witness, as well as the boy also. So between 12 and 18 is a grey area, and you have to take consent from all of them. Legally valid consent, I have already explained. Then another thing is, don't do anything outside your expertise. Actually, this case was a important case. Some Ayurveda people gave some allopathy medicine and patient died. So clearly they said it should not be done. Now this is becoming a problem in India. Specialization has come in ophthalmology also. Are you a retina specialist? Are you a cornea specialist? Why? So it is better that don't try too much of aggressive management if it is not under your capabilities. So this is also getting important nowadays. Now this one I already said, state of Punjab versus Shivaram. You will not be held liable for any complication. Be sure that you will not be, that is this case, this thing everywhere you can quote actually. And then there is something called confidentiality. That is another pillar of medical ethics, confidentiality. Now this is important. Why this is important? Now everywhere there is webinar, and in fact one of the PG classes of KSOS, the PG who presented so and so name this many years, address also, and showed the face. And this is going into YouTube. I immediately called and said, if somebody sees this, oh, this is our confidentiality, breach of confidentiality means there will be trouble, especially whatever you are uploading in YouTube. So that is important. So you have to keep the, you can break the confidentiality if the disease is a public problem, public nuisance like a transmission disease or something like that. So otherwise you should keep the confidentiality. Now receipts allocator we already said, that was actually MOP inside, that was Achitrao Haribabu Kodwa versus state of Maharashtra. So that is another important case. Avoid unnecessary thing. Anyway, we can't put ghost piece and this thing inside the eye. Maximum probably you can put is some what I don't know, silicone oil and some sutures or I don't know. Another thing is that no. One receipts allocator case is there. you drop an IOL, put another IOL over it. Many of you might have seen. That is restrictive locator. If you are not told the patient, that is a classic restrictive locator of ophthalmology. And we have cases, we have lost cases. You have not told the patient there is another IOL lying inside. So that is how compensation is calculated. That is another thing. There was a multiplier method used initially, some formalizer. Now it is called the principle of substitutio in integram. In other words, suppose Anand Vinakas, one boy becomes blind. After 18 years he will sue. Then throughout his life, how much he will earn and roughly a percentage of that will be given. So the highest, he will be talking about that in ROP. So highest awarded in ophthalmology is regarding ROP. So younger the patient, more troubles, more. So this is important in our scenario, our coverage in professional indemnity schemes. So you should not take 5 lakh and all. 5 lakh will be okay for a person with some irritation in the eye. Suppose the patient loses vision, it will be 50 lakhs, 1 crore like that. So always take IMA professional protection scheme, enhance your this thing by 10,000, paying 10,000 rupees extra, you will have 1 crore coverage. IMA, all of you are IMA members, I think. So that is the most important thing. Just online you can enhance. We have a IMA scheme. Just enhance it by 10,000 rupees. Every year you have to give 11,000 rupees. But that is the best thing. 1 crore is at least there. So that is it. And then these are some of the cases. Prashant Tanaka case, it was 3 crores or something, 20-year-old student. Then Krishna Kumar, he will tell, Krishna Kumar ROP case, very famous case against Egmore Eye Hospital. It was 1 crore 38 lakhs. And Balram Prasad, Kunal Saha, highest probably, it was 7 crores nearly. So these are the amount of thing that now, as I said, CPA 1986 and 2019 has made our life more miserable because that amount they can claim has been increased, and Bihar can now give a consumer protection case in Bihar against you sitting in Calicut. So that is also there. Now that thing is also there. So that is the law of limited jurisdiction, everything, appellate courts, everything has been discussed. Few questions and then we will go to the keynote address by Dr. Anand Vinay. We are already judges of our own rights. Now what is remaining is to become lawyers so as to defend it. Major saying. So that is the important thing. Nothing to worry about all these cases. Yes, sir.
I have one question and one comment. One is for cataract surgery. Yeah. If you take our institution, we take informed consent for all complicated surgery. But cataract surgery, you need to take informed consent. For example, in the consent, you are writing phacoemulsification with intraocular lens implantation. But for some reason, you are not putting in an IOL. You couldn't put in an IOL. But your consent has said phacoemulsification plus intraocular lens implantation. So is it necessary to take informed consent for cataract surgery?
Informed consent is, see, there are two things. Printed field consent is not valid. That is the current standard in India. Delhi High Court clearly said that printed consent where you filled phaco IOL and signed is not valid. So you have to at least make the patient വായിച്ച് മനസ്സിലാക്കി read and approved and then sign with the 2 witnesses and doctors. So this is what the standard thing. In that what you write is the important thing. There is a clause below that sometimes there will be alteration in the procedure. Like if you cannot do phacoemulsification, you have to convert it to SICS. That should be acceptable. But if you don't put the IOL, the basic things should be there in that consent. That's what we have to go through our own consent and see whether everything is there.
In any surgery note, there will be a clause that any alterations procedure can be done. If it is there, no, it's acceptable.
It is reasonably acceptable.
Any complication which is not mentioned in your list, no. Even if it is like this is
yeah.
Any complication which is not mentioned consent, it implies that the patient was not informed of that. That's the ultimate thing.
Yeah.
So whatever complications we can mention, no, better than it's
at least that most of the things has to be covered in that this thing, IOL, putting IOL, PCR and all this stuff. Mahesh, yeah, will be only 20 minutes. 20 minutes. Okay.